Hello, my name is Dr. Pierre Fotso. I am the Associate Director of Inpatient Medicine at Orlando Regional Medical Center here in Florida. Dr. Uwan has asked me to share a few words. I will first say that interacting with Dr. Uwan helps me see that sickle cell disease doesn't define who a person is. Despite the challenges they face, they remain very active members of our society with goals, ambitions, and contributions. Healthcare professionals should recognize this and shed their bias towards this patient population. It was my pleasure to address Dr. Uwan's first graduating class for her medical advocacy training program back in June of this year. Patients with sickle cell disease, as well as caregivers, including a few nurses, were trained by Dr. Uwan on emergency sickle cell management using guidelines from the National Institutes of Health and American Society of Hematology. They received a certificate of completion for the 12-week program they participated in. It was obvious that they had taken it seriously and that it was a meaningful learning experience for them. They took a pledge to use the knowledge they had been empowered with to help the sickle cell community, which was really admirable. I personally believe that these advocates accompanying patients during ER visits can be resourceful to ER nurses who don't always understand the urgency of sickle cell crisis. I dare say it might even help some of my colleagues who are not always up to date on the federal guidelines for sickle cell disease management. Knowing the condition of healthcare for adults living with sickle cell disease, I highly support Dr. Uwan's efforts and hope she is able to garner the funding needed to make the program a continued success. Thank you.